My name is Professor Noel Caplice. I'm Professor of Cardiovascular Sciences at University College Cork, and I'm a consultant interventional cardiologist at the Cork University Hospital in Ireland. Over the past 10 to 15 years, our group has been interested in the effects of stem cells in the cardiovascular system. We've particularly been interested in the mechanism by which stem cells work in repairing the heart. And over a decade ago, we did some fundamental experiments where we showed that cardiac stem cells work predominantly by secreting factors from the cells, and that they're more effective in modifying the vasculature than heart muscle. So we focused on a vascular stem cell called an endothelial progenitor cell about a decade ago, and asked the question whether we could identify the factors that were released from these progenitors, and whether these factors could be exploited specifically for pharmacotherapy in the heart. Our initial experiments were carried out in mice, and we showed very effectively that the secreted factors from these progenitor cells were as effective as the cells themselves. So we could discard the cells and focus on what factors were secreted from them. We subsequently went on to a larger animal model, which is more germane to human disease, and that's the pig model. And we showed quite effectively that we could isolate two specific factors and subsequently one factor, which was really responsible for most of the clinical effects of the growth factors released from these stem cells. And we identified this growth factor about 8 years ago as insulin-like growth factor 1. Now, insulin-like growth factor 1 is a peptide small protein which is similar to insulin, but also is different in the way it acts on cells, in that it is a growth promoter. It's very important for survival of cardiac muscle, and in fact it's probably the most important cardiac survival agent. But we also determined in our pig experiments that the concentrations of and dose of IGF1 that we needed to give to the pigs was about 100,000 times lower than insulin-like growth factor that's used in the clinical situation, which is for dwarfism. So insulin-like growth factor has already been approved as a drug for treating dwarfism, particularly associated with insulin-like growth factor deficiency. And so we were quite excited to go forward to see whether an animal model would prove that these very low concentrations of IGF1 were effective in the heart. And so we created an animal model which was very similar to a human heart disease, and showed that when we created a large heart attack, that if we injected very low concentrations of this insulin-like growth factor, we got immediate cessation of cell death in about 50% of the heart that was affected. And also showed that within 2 months afterwards, this had a dramatic effect on remodeling of the heart, namely reduction in expansion of the heart size, and also preservation of the integrity of the wall. As a consequence, both the relaxation function and the contraction of the function of the heart were dramatically improved. Now, we did a number of subsequent experiments showing the timing and the dose that were relevant for clinical practice, and then we approached the regulatory authorities and said we have very convincing animal data suggesting that this very low dose of insulin-like growth factor might be effective in humans, and we wished to try it in a phase 1 safety and early efficacy trial in a small number of patients, approximately 47 patients. We've now completed this trial in our own center. These were patients who had very large heart attacks, sufficiently large to reduce the contractile function of the heart to less than 40% ejection fraction. And these patients, a substantial number of these patients we know in clinical practice, about 20% of them, go on to long-term heart failure, and a number of these patients also need implantable defibrillators. So this is a clinical and unmet clinical need right now, and we felt that this would be an added bonus for using this therapy. The completion of the trial was in December of last year, and we've now completed the analysis, and I can say that low-dose insulin-like growth factor 1 is safe in terms of the safety endpoints that we looked at both immediately at 30 days and also at long-term follow-up. we can say that the initial primary efficacy endpoint, which was pump function or LV ejection fraction, was not significantly different with the IGF1 group compared to the placebo. However, the secondary safety or efficacy endpoints, particularly those of LV volume, LV wall motion, and most specifically LV mass, were significantly improved in the highest dose of IGF1 compared to the lowest dose and placebo. Now, whilst the study was not specifically powered to look at these bigger efficacy endpoints, it certainly is quite promising, and we believe that there's sufficient interesting data in the study to warrant a larger study in a larger cohort of patients in a phase 2/3 randomized controlled clinical trial.